Well, the late-night comedians are not the only ones taking note of Governor Christie's lap band surgery. Some 220,000 weight loss surgeries are performed every year. Dr. Mitchell Roslin is the chief of obesity surgery at Lenox Hill Hospital in New York City and joins us this morning. Good to see you, doctor. Help us understand exactly how it works, and do you think it's a good procedure? Your thoughts on the procedure?
Well, I think it's a good procedure. I think that for people who really struggle with their weight, there may be options that are more efficacious. But what a band does is it puts a ring around the first portion of the stomach, or a belt, and inside that belt is a balloon that we can tighten so it makes it more difficult to eat and makes people eat much slower. Not everybody gets less hungry with it, which is one of the differences that we see with some of the other procedures.
Some of the side effects, though, are quite troubling. I've talked to people who've had this surgery before. As you say, it doesn't make you less hungry, just restrict stuff. So there sometimes are some adverse side effects, right? Well,
what people like about the band is that the recovery is rapid. You go straight home. We're not, making a seam or a new staple line, but the results are more variable down the line, so that more people are going to be dissatisfied with their weight loss. More people are going to require other operations. But you have to put this into perspective. It's still far better than any non-control system treatment.
Yes.
But is it losing favor?
Lap bands are losing favor compared to certain of the stapling procedures, but the wrong message. One of the real important messages here is that when you get severely obese, okay, the methods that we've used to even prevent obesity, which haven't worked, are not effective treatment. Right. The definition of insanity is doing the same experiment and expecting a different result. People
need help.
People see the Biggest Loser and they get the wrong impression. That's not.
And it's so much more than eat less, move more.
It is so much more. Once you've reached your, once you've reached, extreme size like Governor Christie, you're not going to lose more than 5 to 10% of your body weight, even
And to stay at that weight would have been life-threatening for Governor Christie?
Well, absolutely, and interferes with the quality of his life. I'm sure he had conditions like sleep apnea. Look, he's thought about this for years, and obviously the frustration factor has increased that made him act at this point in time in his life.
All right, Dr. Mitchell Roslin, good to see you. Thank you.